This film features genuine patients.
So I'd just come back from my honeymoon and I looked at my phone and it was like there was water on it. But I gave it a wipe, it didn't clear, and I realised it wasn't water on the phone, there was actually a problem with my eye.
If you have diabetes, you have a 1 in 10 chance of developing problems with your eyesight, which could lead to blindness. When you go for eye screening, your healthcare team will look for early signs of these changes. If we catch the changes early, before any symptoms, they are much easier to treat. But a lot of people are too scared to get the laser treatment they need.
My eyesight is incredibly important to me. It's part of me maintaining my independence.
I've got a beautiful little boy, he's just 2 years old and he's just so wonderful to watch. It just makes memories so much more expressive when you can see them.
When you're younger, it all seems quite far removed. You still think you're invincible and it can't happen to you. Then you realise, oh, actually, it can.
The idea of losing my sight is scary because I have seen firsthand in my family eyesight deterioration. I don't want that to happen to me.
And so there was a time where I lost sight in both eyes at the one time, and that just really made me realise how much you use your sight for. And so my world just got smaller and smaller and smaller. And that was just a really, really tough time. It made me realise just quite how important it was to get to these appointments and do as much as I can to keep what vision I can.
Laser treatment is simple, safe, and can preserve your eyesight.
I was very keen to ensure that I maintained my eyesight. The thought of not going never crossed my mind.
I was on board with having the treatment, but I was scared. Anything with the eyes always feels quite sensitive.
It was a very straightforward process, really. I realised, I was in very good hands, I was in very safe hands.
This is a picture of your right eye, and this is the optic nerve, and these are the blood vessels. Just come forwards and put your chin on the chin rest.
I thought it would be a shock or a burn sensation.
Okay, we're about halfway there. Do you want me to slow down a bit?
Yes, please. But actually, it just felt like it was being touched very lightly.
It really wasn't the big deal that I thought it was going to be.
10 out of 10 times without thinking about it, if someone offered it to me, oh yeah, you can keep your vision, but you've got to turn up every 3 months for the rest of your life, I'd go, yeah, I'll have that deal, thank you. No issues at all.
It's just the three of us, and yeah, they just fill my life up, and a lot of that depends on being able to see it.
Losing your sight can be such a debilitating thing. If you're offered the treatment, then please do take it.
You never want to be sitting there with regrets thinking, I wonder if this could have been avoided. You really have nothing to lose.
If your sight is important to you, attend your screening appointments. And if you are offered laser treatment, make sure you go. Three ways to find out more about laser treatment. Talk to your diabetes healthcare team. Go to tinyurl.com/diabetes-I, phone your local eye screening service. Find the number at www.nhs.uk. Search screening.